Section 1. A patient's plea. Cancer and the NHS crisis. Nathaniel Dye is a music teacher. He is 38 years old. Nathaniel has stage 4 bowel cancer. He faced delays in diagnosis and treatment. He blames the Conservative government for underfunding and mismanagement. Many voters feel the same way. Nathaniel now supports the Labour Party. He believes they can help by promising more funding and NHS reform. Nathaniel's story highlights the need for good healthcare. The NHS must be funded well for timely and effective care. Kindly drop a comment, like, subscribe, and share with your friends. Thank you for visiting Insight Harbour. Section 2. The Conservative Record. 14 years of healthcare challenges. The Conservative Party has been in power for 14 years. They are facing criticism. People are unhappy with their handling of the NHS. Critics say the Conservatives have not invested enough. Patients and healthcare workers are worried. Wait times are longer. There are not enough staff. The quality of care is going down. The Conservatives say they have increased funding. They say the NHS is getting better. They argue that their reforms are needed. They say this will make the NHS sustainable. Healthcare will be a big issue in the election. Voters will soon go to the polls. They need to decide. Should they believe the Conservatives? The election is important. It will affect the future of the NHS. Section 3. Labour's promises. Increased funding and reform. The Labour Party sees the problems in the NHS. They are talking about it a lot in their election campaign. They have promised to increase funding. They say they will reverse the damage done by the Conservatives. Labour also wants to hire more staff. They will increase the number of doctors and nurses. Labour wants to reform the NHS. They want to make it more efficient. They say they will reduce bureaucracy. They will invest in technology. They also want to focus on prevention. Labour believes their plan will improve patient care. They say it will make the NHS sustainable. Healthcare is important to UK voters. Labour knows this. Their promises are popular. Voters are worried about the NHS. They want it to be good. Section 4. A system under strain. Demand outpacing resources. The NHS is in trouble. It is like many healthcare systems around the world. The population is ageing. There are more people with long-term illnesses. Medical technology is more advanced. All of this means there is more demand for healthcare. The NHS cannot keep up. This leads to longer wait times. Staff are overworked. Patients are not happy. The COVID-19 pandemic made things worse. The NHS was under a lot of strain. The pandemic showed how important it is to have a strong healthcare system. It also showed the weaknesses in the NHS. The UK needs change. The NHS needs investment and reform. The challenges are not easy. The UK needs to find a solution. It needs to balance good quality care with limited resources. This is important for the future of healthcare in the UK. Section 5. The future of the NHS, a crossroads of choice. The election is important. It will decide the future of the NHS. Voters have a choice. Do they stay with the Conservatives or choose Labour? The election will impact healthcare in the UK. It will decide how people access care. It will decide the quality of services. It will decide the health of the nation. The debate over the NHS is about values. What should the government provide? How important are essential services? It is a debate about fairness. It is about the relationship between citizens and the state. The choices made now will affect future generations. Nathaniel Dye's story is important. It reminds us what is at stake. The future of the NHS is uncertain. The decisions made now will be important. They will shape the healthcare landscape for years to come.